So I wish to thank AIOS for giving me this wonderful opportunity to present. So my topic is sutureless pterygium surgery, the autologous blood method. Already two speakers have discussed wonderfully about the same technique. So I feel very embarrassed that I'm speaking about the same thing again and again. So I'll be showing just my surgical technique for this, and I will not be talking much about the pros and cons because anyways we have discussed all those and I'll be saying the same thing again and again. So after removing the pterygium head by aversion method, uh, just polishing the pterygium remnant from the cornea. Now, as we know, pterygium is actually a subconjunctival disease. So I'll just preserve the conjunctiva and remove the pterygium tissue from underneath it and cut it out. Now using a corneal burr, I've tried to uh, polish the remnants. We can see that this is a complication which happens with the corneal burr, that sometimes the conjunctiva might get caught and we might get this. Now what Dr. Priya Suman was talking about, the newest technique, I was trying to do this technique in this patient, but since the conjunctiva get caught in my corneal burr, I cannot do this now, so I'll just put a graft like a normal pterygium surgery. So the graft is taken slightly larger than the area dissected so that it can be placed under the conjunctiva on all sides. This aids in preventing the graft from displacing in the post-surgical period. Again, we have to make sure that the limbal side is on the limbal side. Now I'll just leave it like this for 10 minutes and after that just close the case. Gives wonderful results. This is another case. Same technique I'm following here. We're trying to remove all the remnant pterygium tissue from the limbal area. Cutting out a subconjunctival tissue. I don't use cautery in my patients because I believe cautery causes a lot of cicatrization and pain in the post-operative period. And autologous blood is actually really fast healing and gives least uh, irritation to the patient also. Removing the excess fluids. Graft is well placed in the area. We just have to make sure that the limbus is on the correct orientation. Leave the graft there for 10 minutes and it will stick.
A very nice presentation, Dr. Ankit. How do you assure the stability of the graft?
So
in how many cases the graft got displaced from its place?
Sir, I did 34 cases in a year.
Okay.
We do a lot of charitable work, so for us having a glue was becoming a bit of an issue because these patients don't pay anything to us.
Finances must be a prohibition.
Yeah, and sutures, the patients started complaining after pricking and all these issues were there. So started doing this, and in my 34 cases in last 1 year, I have not had a single graft displacement.
That's very encouraging.
A few cases had graft contraction, but apart from that, there has not been any recurrence or graft displacement.
Very good presentation.
Thank you, sir.
I request Dr. Neetu, please.
Yeah, graft edema was there in a lot of cases in the first 1 week, 15 days, but they all resolved completely by 1 month. Huh? Yes.
Okay, that's true.